Many people do not make the connection between these feelings and their hearing loss. They are frustration. Frustration comes with the speaker and the listener. The listener is frustrated because they cannot get the information, and a speaker may be frustrated because they have to repeat the information so much. Anxiety and discomfort. Hard of hearing folks who struggle to hear all day may become very tired. Impatient. Communication is a two-way street, and impatience can come on either side. A hard of hearing person many times feel a loss of competence. They think that when they miss things, it has said something about their brain, while it is just really something wrong with their ears. They might have self-pity. Guilt. Many hard of hearing people withdraw. They withdraw from activities because they can't keep up. They may also be in denial. They might say their hearing loss is not bad enough to do anything about it. They might blame others for mumbling. Once this person suspects they have a hearing loss, they should be seen by an audiologist for a hearing evaluation.
Audiologists are healthcare professionals who identify, assess, and manage disorders of auditory, balance, and other neural systems. Audiologists hold a graduate or a doctorate degree and hold professional certification from an accrediting body called ASHA, the American Speech, Language, and Hearing Association, and also hold a state license. When you suspect that an individual has a hearing loss, you can make different referrals to ensure the proper detection and management of that individual's hearing loss. You may refer that individual to their primary care physician, who in turn will refer that individual to an audiologist for testing. A referral may also be made to an ear, nose, and throat physician that would include an otologic evaluation and a hearing evaluation of the patient. You may also refer directly to an audiologist's office that sometimes is in a hospital, a clinic, or a private practice office. Or you may refer them to the Center for the Deaf and Hard of Hearing for full audiologic and speech evaluations. Next, I'd like to talk to you about hearing aids. Hearing aids come in a variety of shapes, sizes, colors, and types. The most common style hearing aid is a behind-the-ear hearing aid. This hearing aid is worn behind the ear and coupled via an ear mold to the patient's ear. This can be used by patients with mild to severe hearing losses. The in-the-ear style hearing aid is another common type of hearing aid. This hearing aid is worn entirely in the bowl of the ear, and part of it goes into the ear canal. This hearing aid has been the most popular type for 20 years. Another type of hearing aid is an in-the-canal hearing aid. This type of hearing aid fits entirely into the external ear canal with slight protrusion into the bowl of the ear. They are limited in power by their size and used mainly by those with mild to moderate degrees of hearing loss. The size of this type of hearing aid makes it more difficult for some elderly patients to use. The next type of hearing aid is completely in the canal hearing aid. This style hearing aid sits deep into the external auditory canal. This type of hearing aid is designed mainly for mild to moderate hearing losses. Now we'll talk a little bit more about some uncommon style hearing aids. The first type is called a contralateral routing of signal hearing aid. Another uncommon style hearing aid is called a bone conduction hearing aid. Another uncommon style of hearing aid is a body aid. This is reserved typically for patients with profound hearing loss. Another uncommon style are eyeglass hearing aids. This is hearing aids that are built into the temple bars of eyeglasses. Now we'll take a look at some specific parts of the hearing aid. First of all, we have the microphone. This is the piece that picks up the acoustic signal from the environment and changes it to an electrical signal. Then the sound travels to the amplifier. This is the internal circuitry of the hearing aid that increases the magnitude of the signal. Next, the sound travels through the receiver that converts the electrical signal to an acoustical signal, sending it into the ear. There are some pieces that are specific to a behind-the-ear hearing aid: the ear hook or elbow, the ear mold, and the tubing, as seen here. Another piece or part of a hearing aid is the volume wheel. On the behind-the-ear hearing aid, the volume wheel rotates up and down, and on the in-the-ear hearing aid, it can also act as an on-off switch. Another component that's contained on hearing aids are what's called an MTO switch. The MTO switch stands for microphone, telephone, and off. What you see here are the battery doors for the behind-the-ear hearing aid, and next, the in-the-ear style hearing aid. It's important that hearing aid batteries are changed every 1 to 2 weeks depending on the style hearing aid an individual has. It's often helpful to work over a towel when changing the battery on a table, so if the battery drops, that it doesn't roll. The smaller the hearing aid, the smaller the battery, and the faster that battery will drain. Some hearing aids have warnings that will let an individual know when the hearing aid battery is about to deplete. Other times, the hearing aid will just stop working. One easy way to test this is hold the hearing aid in your hand and make a fist around the hearing aid. If you hear a whistling sound, then you'll know that the battery is working. Cleaning the hearing aid is also very important. Making sure the hearing aid is free from wax and debris and stays away from moisture or perspiration are very important. It's sometimes very helpful to have a battery tester on hand to ensure that the batteries are functioning. And it's also important to have a brush and a wax loop to clean out the internal components of the hearing aid. Another way to clean the hearing aid is using